I think the GBC was really innovative in that for the first time, initially for a specific disease, it set standards for how business should be involved, and really across three areas: taking care of your own workers, your employees, looking at how you could make a contribution in the local community, and then harnessing the power of business advocacy or its core competencies to help other partners deal with this major public health crisis. And I think what the GBC has then done has taken these principles and applied them more generally to health. The private sector's a really crucial partner to PANGAEA. We operate under the recognition, the primary understanding that no one sector can do this on their own. And so we have collaborations with Chevron, with VEEF, with Levi Strauss, and it's really a two-way street. They make use of our expertise in monitoring and evaluating programs. They provide invaluable support to us that we wouldn't get, say, from US federal grants or from international institutions. And we also take their advice on where we can have the greatest impact, and that's both in terms of which populations to serve, but also which countries to be based in. That's a tough question. There is something pretty unique about HIV in the history of public health. You have an epidemic of a virus that spreads very rapidly, but which takes many years to appear. And so our understanding of how much infection there was in the world took us a long time to get there. The really significant thing about the MDG movement is a recognition that for the world to be vibrant, to be healthy, and to be economically and socially secure, we've got to make progress across a number of social and development fields. Where I think the opportunity really lies is in integrating the experience of HIV with some really core social and health development priorities like family planning, like sexual reproductive health. And I was very pleased to see that our opening session at the GBC conference really focused in on family planning. And I think that's really significant and a very important development. Business savvy, business know-how, I think, is the most important contribution. The ability to get things done quickly, with an adequate but minimum basis of knowledge, the ability to vet and monitor what you're doing in real time. These are really key core competencies that are at the heart of every successful business. And frankly, it's what we in the development field and in the public health field have really not been able to use at all. So these skills, I think, are going to have the potential to make a really dramatic difference in the way that we respond to public health crises now and moving forward.